Last year, our MS Now colleague Jacob Soboroff published a story titled The Death of Estela Ramos Batten. Estela died in September of 2025, shortly after she and her teenage daughter, Nori, were deported to Guatemala. Here's part of Jacob's reporting.
Speaking to Nori over the phone, she told us since that her mom had been consumed with stress since their deportation. She was barely sleeping. And Estela also suffered from liver cirrhosis, a chronic disease often related to alcohol abuse that experts say can significantly affect blood pressure. According to Estela's daughter, her mom gave up drinking a long time ago, but after being deported without her medication, she had no way of treating her symptoms. On Monday, around 7 o'clock at night in Guatemala, Estela told Nori she wasn't feeling well, but she refused to be taken to the hospital because she was too scared to leave the house. Hours later, she died. The money Nori and her mom had saved to pay for a lawyer to appeal their deportation was used to pay for Estela's funeral and her burial. With what little remains, the family bought a traditional Mayan dress so that Estela can be buried in it, a last gift from her family to her.
Nori told MS Now, quote, "I want people to know that my mom's medications were taken away and not returned. They took away my mother's medicine. I had no way to help her." Estela's story is tragic. And unfortunately, stories like hers are becoming more common here in the United States since the beginning of Donald Trump's inhumane immigration crackdown. A 2025 Kaiser Family Foundation New York Times survey found that nearly half, 48%, of likely undocumented immigrants and 14% of immigrant adults overall say they or a family member have avoided seeking medical care since January 2025 due to immigration-related concerns. When people in communities are menaced out of seeking medical care, that means they stay sick. It means that sickness stays in the community. Germs don't check your papers. It means time out of work. It can mean that an easily treatable ailment could blow up into a dangerous and costly emergency situation. And doctors from across the country are taking notice. The New York Times recently published an op-ed from 3 Philadelphia doctors that have had patients fall ill or die after avoiding preventative care. The things that happen to our patients are inevitable consequences of ICE treating people and families as targets rather than as human beings, carrying out enforcement without any consideration of medical risk or family circumstances. Detention, deportation, and family separation don't merely cause social and legal harm. They also create profound medical stress that exacerbates chronic diseases, worsens mental health, and induces medical crises. Making it dangerous to seek medical attention does not make anyone safer or healthier. When people are deterred from preventive care, treatable conditions worsen, emergency department utilization increases, and costs rise for everyone. And a California doctor elaborated on the strain this is causing American healthcare systems in this op-ed published in the San Francisco Chronicle. Over the past year, the Trump administration's immigration crackdown has spilled into emergency departments and hospitals across the country. And with the federal government's 2025 decision to allow immigration agents into sensitive locations like medical facilities and schools, hospitals have become front lines of heated battles. 32 people died in immigration and customs enforcement custody in 2025, the highest recorded number of deaths in more than 2 decades. And most died in hospitals near detention centers. The death toll in 2026 already outpaces last year's. Detainees are often held in overcrowded conditions with inadequate food, little to no health services, and without their necessary medications. Hospitals and healthcare institutions must do more to protect all of our patients and the providers who take care of them. The integrity of our emergency departments and the entire medical safety net is at stake. Joining us now, Dr. Vin Gupta, a practicing pulmonologist and an affiliate professor at the Institute for Health Metrics and Evaluation. He is also an MS Now medical contributor. Dr. Gupta, thank you for being here. Do you know of any stories about patients who have avoided necessary medical treatment because of their immigration status?
Absolutely, Jonathan. The tragic story of Estela is emblematic of what's happening in every zip code across the country. And it's not just those that may not have the proper papers. It's those that have legal status as well. We're seeing an epidemic here of people avoiding care if they're an immigrant and their family members. If they have children, they're keeping their children home from needed vaccinations. They're an adult from needed screenings. You said it in the tee up here. There's a few studies that have shown up to 84% of providers have seen that their patient population has declined utilization of services, preventive care, necessary care for an infectious disease. We're seeing delayed treatment as a result. So this is in every zip code across the country. And frankly, Jonathan, it often goes unnoticed in some cases because what you don't necessarily see, you don't know is happening, but this is happening everywhere.
Mm-hmm. Dr. Gupta, can you walk us through what happens if a person who's not a citizen comes to the ER for care? And can ICE enter hospitals?
They can. And so this is something that has changed over the last year of the Trump administration, Jonathan, where these sanctuary policies, where certain places were considered sacred, they are no longer. And so ICE agents, for example, can enter a hospital, go into common grounds like a waiting room, and can wait in hallways. And that's what they're doing. They're actually going in certain places in hospitals, say in Minnesota, they're waiting in they're patrolling hallways. They're intimidating patients. They're intimidating providers. Often providers don't even know what to do. And so that's why there's an education effort underway to make sure patients and providers know their rights, know how to educate patients. But yes, ICE agents can now actually be on premises in a way that they were not allowed to necessarily be on premises back before January 20th of last year.
Well, Dr. Gupta, that's what I was going to ask you. Are medical professionals being trained in how to deal with ICE menacing healthcare centers?
Yes. And so, it's a state-by-state approach. I will say a lot. ACLU, the American Federation of Teachers, other entities are trying to do this education. Hospitals, to a certain degree, are trying to do it. Take California, I would say Governor Newsom and the efforts in California are the nation's leading efforts at the state level, Jonathan, to make sure that patients, providers, health systems know their rights. For example, in California, they're trying to pass the No Secret Police Act, where you can't actually cover your face, act like a police officer or an ICE enforcement agent, and intimidate people on site. Other efforts in California protecting the immigration status of patients. These are important to be doing in every state across the union. But to your point, what can providers and health system leaders make sure that everybody is aware of if you're caring for patients in health facilities across the country? First, designate one point of contact. Usually it's somebody in compliance or law who has that background. If you're a provider out there, you're watching this show right now, make sure you know who that point of contact is. If you see an ICE agent, make sure you know who that point of contact is. And coarsely direct that agent to that individual. Verify warrants. Jonathan, this is something that, again, happening in California and other places across the country sporadically. But you need to have a judicial warrant to then enter a clinical treatment area. You can be in the hallway if you're an ICE agent, unfortunately, but you can't enter an actual patient treatment room without a judicial warrant, not an administrative warrant. That's a key difference there. Protecting patient privacy. Patient privacy still applies. You do not share any information with an ICE agent unless they present a court order specifically asking for it. That's really important. And I would just say keep care uninterrupted. Stay calm, continue patient care. And that's really the most important thing, more than anything else, is that continuity of care.